Okay, here it is. Topic, pressure sores. It's a big one. It can be scary. Let's start with just understanding what they are. Basically, people get pressure sores when there is pressure to an area of the body that prevents blood flow to nourish the cells, and those cells die. And often they are skin cells or underlying tissue cells. So an experienced nurse once kind of instructed me when I first started that, if you see a lot of open sores on the top of the buttock or near the coccyx there, near the tailbone area, that usually indicates that perhaps they've been lying in the same position in bed for too long. And if you see them kind of in the lower buttock area, that means they've been sitting up for too long in the same position. And as a person gets older and less able to reposition or move themselves around, the more wheelchair bound they are and can't move themselves around in a wheelchair, the more weight they lose and don't have, that fat padding and can't cushion that. That's when they get more vulnerable to pressure sores. And a facility really from the very get-go, when they get admitted, and every 3 months after that, they have to do a pressure sore assessment, often called a Braden scale. That's the standard used in a lot of homes, called Braden scales, that test or assess their risk for a pressure sore. If you have a loved one who's assessed with a high Braden scale, a high risk of pressure sores, and they don't have one yet, you probably want to make sure that things are in place to prevent that from happening. Because once it happens, it's not pretty, and it's painful, and you don't want your loved one having that. So some of the things you can do are meet with the DON and say, hey, what are we doing to make sure they don't have a pressure sore? One thing you can recommend is, since they're at such a high risk, can we put a low loss air mattress in? That's a special mattress they usually put in once somebody gets a pressure sore, but they can put it in preventively too. And if you ask nice, they might accommodate you because basically it distributes the weight of the body, so not any one area is getting too much pressure. If you got like a bony senior in one of those beds, that helps prevent them from getting those areas. The other thing you can do is make sure staff are repositioning your loved one, which is a little bit trickier, but it can be done. They're supposed to be doing it every 2 hours for those people who can't reposition themselves, but they often don't. I mean, if somebody's sitting in a chair, they might just pop them up and down real quick, but that's not really going to do it. If they're laying in bed, you can try to work with the DON and arrange like a little clock saying that between 12 and 2, they're going to be turned toward the door, and between 2 and 4, will be turned toward the window, and that clock will kind of show staff the direction. It'll give them the information they need to know. You go in, it's the time is maybe half an hour after they're supposed to turn somebody. Well, then you tell them. I mean, they're not going to get to it right away. So my suggestion is you can go in there and check the clock, see if staff are doing what they should be doing. I wouldn't make an issue unless it's like half an hour, more than half an hour late. But that would be something you could do. Like I said, remember how the whole idea about instructing staff and writing plans down? That's something I want you to do. That's interesting. There's a little campsite right there. I guess some people will camp there occasionally. So that's one thing you can do. The other thing you can do, if they're having a hard time, if they're very vulnerable like that, sometimes laying down between meals, because incontinence is another factor. It's another risk factor for pressure sores. You can ask that they be laid down between meals, because then they'll at least hopefully take the brief off and put a new clean brief on them. And then they shift the weight, because, think about it. If you're get up at 5 in the morning, and then you stay up between breakfast and lunch, you couldn't, if you aren't laid down again until the afternoon, that could be like at 2 o'clock. So from 5 o'clock to 2 o'clock, what's that, like 9 hours almost, I guess? That's a lot of time to be sitting in that wheelchair in that same position, you know? You want, and the same goes really for the afternoon lie down too. I would probably insist on that as well. You know, even if it's just an hour, at least it's off that same area in the lower buttock for a couple hours, you know? Have them institute that, and like I said in a previous video, you know, check with the night shift staff, making sure it's not going to affect their sleep or their cognition at all, because, you know, not getting the right sleep, that'll messes people up too. But I would recommend that to kind of keep people safe. You know, other things you can do, you know, if they do have an open sore, if you are called about that, you know, there's different stages. You can ask about the stage. A stage 2 is your typical one that, you know, I guess, you know, the best way to describe it, the way it looks at least, is like if you had a scab and somebody just ripped that scab and then you saw the bloody area underneath, kind of like that. A stage 3 and 4 get deeper, and they can go down to muscle and bone even. So those are really concerning. If you've got somebody with a stage 3 or stage 4, you probably need to have a visit with the DON again and just say, hey, what are we doing to address this? Because, you know, it's at this stage now. It's more vulnerable to infection. You don't want to be getting any kind of infection like that going in through the wound. You can ask, hey, can we bring a wound consultant in? A lot of times when they have more serious wounds like those, they'll have a wound consultant in, and she's a specialist that, you know, comes in. I got some people getting ready to pass me. I'm gonna stop and wait a little bit. Wow, I just was talking to these hikers here, and they're doing like 4 days, you know. God bless them. I'll give them kudos for that. You know, but I'm more of a day hiker kind of guy. But, you know, my hat's off to them. Hey, so where we left off, I was talking about a wound nurse. So yeah, a wound nurse is an expert or specialist that deals just with new wounds. So she's going to know like the latest treatments that are most effective, and she can show staff how to do those treatments. So yeah, ask about doing a wound nurse. They'll probably do it, because a lot of times it's getting more common. I've noticed that they'll have a wound nurse comes in. The other thing about a wound nurse is that, man, they do excellent assessments. They are very thorough with their assessments of wounds, you know. And anyway, ask about that. If you got a serious wound, also, I would, you know, make sure they should be, hopefully they already are, if they have a pressure sore, they're already on a low loss air mattress. You remember that mattress that kind of, it distributes the weight? Make sure they're on that. And then their diet. Make sure, especially if they're underweight, make sure that they're doing interventions to help with their weight. You know, protein, they need extra protein. Get those supplements going. Remember those preferences you need to let them know about. All those things can be helpful. Okay, so they got a pressure sore. How do you make sure they're doing the treatment properly, right? Now, almost all of the doctors' skin wound treatments usually are required to be done daily. So when you go in and see your loved one, sorry, I got this at a funny angle here. You know, you look at their wound, look at the bandage. Sometimes the nurses will write the date on that bandage, so you know, okay, are they keeping up with it daily? Other times they don't, but you know what? Do what us inspectors used to do. Put a little pen mark on there, put a little dot, just something real subtle, and come back the next day or the day after, or you know, really the best time to do it is find out when shift changes, because they may do their treatment later in the day, and you don't want to be accusing them of something when they really were going to do it later. So let's say you check it out at noon on a Tuesday, and they're going to leave at 3 o'clock on a Wednesday. The people that do the treatments, the skin treatments, usually the charge nurses will do that, and then get there at 2:30 and check that bandage. You know, is that date updated? Did they do a new one for that day? If not, then you got to go. I would go, something like that's critical. I wouldn't go just to the charge nurse who didn't do it. I'd go to the DON right then and there and say, hey, you know what? They didn't do this wound treatment. Can we make sure we do it? And the charge nurse, believe me, the DON will get on her and she'll probably not make that mistake again. And you'll be watching it again and see that she does, and go from there. And that would be one way to do that. Other things you can do to make sure, hopefully you're the durable power of attorney for healthcare. You know, they should be doing two things. They should be documenting their treatments in something called a treatment administration record. But more importantly, they should be about every week, they should be assessing that wound's characteristics. That's important because you want to know, is that wound getting better or getting worse? You know, you want to look at the physician order. Let's say you have a wound that's getting worse, and that order has been out there for 6 weeks or more. It's like, okay, well, now I think it's time that we consider maybe another treatment. Would another treatment help? Would it not help? Why is it not healing? Let's get to that. Let's figure out what it is. Look at the care plan. They should be care planning it. What is the plan? What's the intervention to prevent that, to help heal it? Are staff doing that? Check it. You know, are they supposed to elevate something or turn it from side to side? You can check, are staff doing those things? So those are all things you can do to help when they do have a wound or before they have a wound. Okay, I think that's it for my suggestions about pressure sores. I hope you found something helpful that you can use. Please give me a like if you did, or share it with friends. And if you need more information, please look at www.nursinghomerisk.com. That's nursinghomeRisk, RISK.com. See you in the next one.